Hello, friends. Welcome back to my YouTube channel, Pathology Academy. I am Dr. Aditi Kumar, and today I will be discussing benign breast tumors with you. So, let's get started. So, let's talk about the most common benign breast tumor, which is fibroadenoma. It's composed of fibrous stroma and ductal epithelium. It's a biphasic tumor. It is mobile, firm, well circumscribed lump on palpation and also known as breast mass. It is hormone sensitive, grows in pregnancy and regresses in menopause. Histologically, it has a biphasic pattern and proliferative fibrous stroma is seen compressing the ducts. It's of two types, intracanalicular and pericanalicular. IHC wise, estrogen receptor is seen positive in duct epithelium. Phyllodes tumor. The benign phyllodes tumor have leaf-like stromal projections. It's also a biphasic tumor with epithelial element and hypercellular stroma. Phyllodes tumor can be benign, borderline, or malignant based on stromatopia, mitosis, margins, and overgrowth. In benign phyllodes, there is mild atypia, low mitotic activity, less than 4 by 10 power, high power field, and pushing margins. I will be talking about borderline and malignant phyllodes tumor when I will be talking about malignant breast tumors. Now let's talk about intraductal papilloma. It's the most common cause of bloody nipple discharge and is located in the large central ducts. Histologically, what you will see is papillary fronts with fibrovascular core lined by both luminal and myoepithelial cells. So if you have to distinguish it from the papillary carcinoma of breast, IHC myoepithelial markers P63 SMA calponin will show positivity and indicate towards the benign nature of the lesion. Tubular and lactating adenomas. In tubular adenoma, you will see small benign epithelial tumor which is histologically tightly packed round tubules with little stroma, and it could often be mistaken for fibroadenoma. Lactating adenoma. Lactating adenoma is seen during pregnancy and lactation. It enlarges due to hormonal stimulation and histologically enlarged glands with secretory changes are seen. This is a gross picture of fibroadenoma. You can appreciate the slit-like spaces on the cut surface. This is a micrograph of fibroadenoma. Here you can see both the epithelial and the stromal components. In benign phyllodes tumor, you can appreciate the leaf-like projections, and there is stromal overgrowth, which causes compressing of the epithelial ducts. This is a micrograph of tubular adenoma, and you can see so many tubules in the micrograph, which depicts tubular adenoma. Sometimes it is difficult to differentiate from fibroadenoma. This is a micrograph from lactating adenoma. Here you can appreciate the vacuolization, which is very prominent in this micrograph. Here in this micrograph, you can appreciate the intraductal papilloma. Sclerosing adenosis is a benign proliferative breast lesion that may mimic carcinoma both clinically and radiologically due to architectural distortion and firm texture. However, it is non-cancerous and does not usually require surgical excision unless atypia is present. In this micrograph, you can see increased number of SNI per lobule, which is compressed and distorted by fibrous stroma. The dense fibrous stroma may entrap glands, mimicking invasive carcinoma. Calcifications are also seen sometimes. So, fibroadenoma is a biphasic tumor. It can have two patterns, pericanalicular and intracanalicular. Phyllodes tumor have leaf-like stromal projections, and intraductal papilloma shows fibrovascular cores with dual cell layers. Benign breast tumors are common in women less than 40 years of age. They will present with symptoms like lump or nipple discharge or mastalgia. Most of the benign breast tumors are mobile and non-tender. All the benign tumors are slow growing except phyllodes tumor. Let's talk about the radiological features. On mammogram, benign breast tumors are well circumscribed radiodense mass. On ultrasound, homogeneous oval shaped lesion with smooth margins, and MRI is reserved for complex and high risk lesions. Always remember, in benign breast tumors, bioepithelial layer is present. So, myoepithelial cell markers are here very important to distinguish between benign and malignant breast tumors. And those myoepithelial markers are P63, SMA, and calponin. And there will be low Ki67 index and benign lesions, as you all know. Talking about the management for fibroadenoma, it's kept under observation, and excision is done if it is more than 2 to 3 centimeter or it is symptomatic. Phyllodes tumor, wide local excision is done with margins. Papilloma is excised especially if ATPI is present. Hematoma or lipoma, observation is done unless symptomatic. Now, what are the red flags when you should consider biopsy? Well, when the tumor is rapidly growing, when there is skin or nipple changes, when there is axillary lymphadenopathy or suspicious imaging features. Now, let's summarize the benign breast tumors. Fibroadenoma affects 15 to 35 years old females. It's a mobile lump, very low malignancy risk. Phyllodes tumor affects 35 to 55 years of age women. It shows leaf-like growth and variable risk is there of malignancy. Papilloma, 30 to 50 years, nipple discharge, and seeing slightly increased risk. Hematoma or lipoma can occur at any age, soft or mixed density, and there is no malignancy risk. I hope this lecture was useful for you all. See you in my next video. Bye for now. I hope this lecture was useful